Welcome, Joanna Joseph, to the episode of Esprit Talks from CSPRIT, a platform where we all live, love, and learn psychology. In this podcast, I, Suhasini, will be the host, and today we'll be talking about psychology and mental health. For our episode, we have Joanna ma'am, a beacon of inspiration in the world of clinical psychology. Welcome, Joanna ma'am.
Thank you. Thank you. Thank you so much, Suhasini, for that beautiful welcome.
Thank you. All right, then let's begin then. Can you walk us through your personal journey towards becoming an established clinical psychologist?
Okay. Yeah, that was quite a journey. I think I started off with my interest in psychology from, I would say, my high school. And I would say I happened to come across it. As usual, like we would start off with, or at least most science students, I think, would start off with, going towards the medical field. Okay, see how that works, how that goes. The usual options you start with. And then once I got the idea of how medical field could be, let's say MBBS in specific, I realized maybe that is not something that I might relate to. Then I started to read up on different fields in the medical field about then that's when I came up with psychology. That I came up with. I didn't come up with it. I mean, I came across that concept and then that whole field, which really intrigued me. And I, for some reason at that time, realized, okay, there's something called psychology. There's something where there's a study about the human mind. There's a study about how the mind and the behavior plays a role, how it's different with different people, but also there is a whole social being behind that. And I was very much intrigued by that. Started to get to, started reading upon it. And then I wanted to see, okay, career wise, how is it going to help? It sounds very good in theory, but what is it in practical world? That I came across that it was very much booming at that time. And how still psychology was still in its infancy stage. I would say still in the fetal stage. And then when I came up on it, I read up on it, and I was very determined that, yeah, I need to do psychology. I want to do BSc in psychology, nothing else, nothing more, which my family didn't understand the point. So that was around which year? I think 2010 maybe, or even earlier than that, I think. And at the time, no one understood what psychology was. My family was like, what is it? Like, are you really sure that's how you want to see your future in? And I'm like, no, I have to and I want to. Got into that field, very determined. Made sure also I went to colleges that had BSc psychology and nothing else. If my family asked me second option, anything else if you don't get, I don't know, like, no, psychology, that's about it. That was really a journey for me to get into that field. I didn't get into one college, and then I was still determined, no, psychology. I for me personally, I find that really my calling. So I'm like, no, I really want to. Fought for it. Got into a college in Tamil Nadu in South India, and then I did my 3 years there. That's when I got into clinical psychology. So psychology as a theory, as a field, it's everywhere. It's in all aspects of the world. So when I found out that there's something called as clinical psychology, so that is, we have that as abnormal psychology in BSc, and I'm like, wow, that is again more interesting. How the mind can actually sometimes actually be your enemy, and it could maybe go the other way around, where man actually need to help you. Like, okay, that doesn't make sense. Like, how does that work? And how, as someone, as a professional, can actually learn on that and help people to work on that. That was again my interest. So I said, okay, now let me try clinical psychology. So there again, I was determined that I wanted to do clinical psychology. Got into masters. That also, I didn't have to fight for it. Rather, I was like, no, I'm comfortable in it, and I think this is what I want to do. Got into clinical psychology. That's when I got into MPhil. So I got into MSc, and then my professors, they were saying that there is something called MPhil, where you would be RCI registered therapist. And again, what is all of that? What is RCI? What is registration? What is all of this? Again, so I feel like my journey in psychology, every step of the way when I make a decision, I would learn something more new about the field that intrigued me even more. So then I'm like, okay, now what about me as a person? Can I handle being a therapist? Can I handle working with different kinds of clients and the different psychological issues that they come with? Then I had to do a little soul searching and say, okay, what is something that I think can benefit for my career as my personal attributes? So I was like, okay, maybe there is something that I can learn, the skills that I need to refine, um, something personally maybe I can work on, I can find out on my own. And then I got into it. I finished my master's. I understood what the idea is. I got into MPhil that too. Getting into MPhil, I had taken like a year break because again, I didn't want to rush into getting MPhil because master's was quite overwhelming. So they were training us so that we could get into MPhil. So masters was more or less like that, seeing clients, seeing patients, doing different kind of assessments and reports. So it was more or less like how an MPhil course would be. So I was quite overwhelmed after a master's in clinical psychology. So then I had taken a break, worked in Kuwait with children with developmental disabilities. I was a behavior therapist for a year and a half. So there also, when I joined behavior therapy, working with children, yeah, great, very fulfilling, and it's an amazing job. And I'm like, no, there's something still more I want to work on. Like there is something that I'm not. I feel like there is something more to this, not just maybe working with only children. I think I want to work with all the kinds of population, and I'm still very intrigued by clinical work and abnormal psychology. So then I was like, okay, that's when I decided again, I'm going to go to clinical psychology. I'm going to do MPhil. I want to practice that for sure. And then got into MPhil. Got into MPhil, and yeah, that was one journey. MPhil, 2 years of MPhil was quite a journey, personally, professionally. Learned a lot, and yeah, and I'm still learning. Definitely still learning. The field is never ending. Still learning. So yeah, and there I am.
Wow, your journey is filled with a lot of unique essence. Talking
Yeah.
about uniqueness, well, what is the reason behind your clear vision? Such clear vision. I would love to know that.
Um, Honestly, I don't know how much of a clear vision it was. Rather, it was like I mentioned, like every step of the way, I was sure that I wanted to be a psychologist, or this is my calling, or this is my field. So even getting into psychology, I was aware that it has different fields, and psychology is something that you can apply it anywhere, be it organization, be it in sports, be it in forensics. So I was very much intrigued by that. The fact that psychology is applied everywhere means I think that confidence that if I even, let's say I'm not okay with certain aspect of the field, I can always fall back on something else. So I got into with a very open mind. I would say a blank slate, honestly. So I finished my UG, and then again the blank slate kind of got filled with, okay, now I think I'm very much intrigued in abnormal psychology. Also, abnormal psychology was a subject we learned in our final year. So until the final year, I was still very confused. Okay, is this really for me? That's when I realized, okay, no, abnormal psychology is something I'm very interested in. Got into that. Then I got into clinical. So even after I finished clinical psychology and masters, I still wasn't sure. Okay, I don't know if this is an okay. Me being a therapist and this much of hard work I have to do, I don't know. That's when I mentioned I worked for a year. That's when I got the idea. No, there is something still I need to. Something is missing. Like I'm not yet getting there somewhere. I'm not sure. That's when I got into clinical MPhil. So for me, the vision came with my every step of the journey. I got in with an open mind, but at the same time, I was quite determined that no, I want to be in this field no matter what. So that's where how it led me. One decision led to the next, led to the next. And yeah, and I'm so forever grateful for that. That open-mindedness really did help me. And yeah, I think that was something that maybe made a difference.
Yes, I love the way you didn't give up on all those self-doubt questions. Can I do it? Can I not do it? Will this go?
Yeah.
How far will I go? I feel like most of the majority of the student population gives up over there. A doubt,
Yeah.
confusion, key, what is going to happen next? Uncertainty is
Mm,
something we are really scared of. And I feel like this is
yeah.
some important message we should always, be mindful about, keep in mind.
Yeah, yeah, that's very, very even for me, definitely being uncertain is very scary. Like I'm not sure whether this is what I wanted, but w- also because when I used to talk to different people about, okay, what is psychology? What is that's interesting? Why are we still working and studying on this, knowing that this has been there for years and on end, and that people are still answering questions. I'm like, okay, there are still some more questions that need to be answered, and I would really like to be part of that search for answers. So yeah, and knowing having those self doubts is so common. Like every minute of the way I was not sure, should I even do clinical, should I do counseling, should I do organization, should I do something else, or should I go into forensic, should I do sports? So it was all over the place. But yeah, having that open mind that okay, even if I take this step, there is always something to fall back on, because again, I would say, because psychology is so vast, there will be something that you can fall back on in this field. So I think keeping that in mind might help.
Definitely, yes. What are some common therapeutic approaches? Could you just differentiate between all those common therapeutic approaches used in therapy nowadays?
Right. So there are different approaches. So usually mostly it started with the psychodynamic. So Freud, he was the one that started off with psychoanalysis. He spoke about um, childhood. He spoke about the drives, the aggressive drives, the sex drives, and everything of that. So they started off with that, the psychodynamic related. He spoke about how developmentally things work and how the psychosexual stages and all of that, which most of us would know about in Freud. Since then, they realize, okay, there's something more to than just that. There is even certain behaviors that we might need to look at in terms of modifying that. What about that? Okay, fine, everything is psychoanalysis, but what about the things where it's pretty obvious, the observable behavior? How do we work on that? That's where behavior therapy came about. So even most of our um, exposure therapies, all of that start off from behavior perspective. Then came the cognitive perspective, where okay, we're talking about the behavior. Now what about the thinking part? For a behavior to occur, something needs to go behind in your mind. So what about that? So that's where the cognitive perspective came, and that's where we have our well-known CBT, cognitive behavioral therapy, which was so widely appreciated, so widely used, because it spoke about cognition, it spoke about behavior, it spoke about beliefs, so core beliefs. That is also something, if you think about it, is a little touch on a little bit of a psychodynamic perspective about beliefs and how that is formed as a child and how that plays a role in your thinking. So again, that's also touching a lot with psychodynamics also. Then came the humanistic. It's about that, okay, there's also an aspect of growth in people, not just about thoughts, not just about the behavior, but there's something more to that. Let's not go back, let's try to go forward for the person. So more of existential. Okay, now what about what is meaning for life? How do we go with that? How do we go beyond just the thought? What about the universe? So again, humanistic is all about growth, about finding meaning in life. Then I would say now there is a new wave of therapy, not now, but yeah, there was a third wave of psychotherapy where mindfulness came into the picture. So again, it uses everything. It's using cognition, it's using behavior, it's also using again the whole mindfulness. Everything together came with the third wave, which is all about being in the present moment. It has a lot to do with an Eastern view on things, where there's more to than just the thoughts. It's about changing your perspective on how the thought is rather than the content of it, seeing the thought as it is, not being judgmental, seeing a thought as a thought and not a fact, not trying to change it, but just being acceptance of it, acceptable of it. That's where the third wave of psychotherapy came out. So that would include or acceptance and commitment therapy. That would include mindfulness-based practices, um, dialectical behavior therapy. So that also is a kind of therapy that uses behavioral perspective, cognitive perspective, and let's say the third way, that is mindfulness based. So DBT in general is, I would say, a really rich module. It uses all different kinds of perspectives. So that was where the turning point happened. Then I would say currently there's a lot of therapy that is trauma focused. So any kind of, let's say, psychological issue an individual has, there could be some kind of, let's say, traumatic event that must have occurred for them. Rather, it's not something huge, as in, let's say, not a big trauma. Rather, even small T traumas that we say, the accumulation of these trauma is what a person is going through currently. And that perspective then came about working on the family dynamics, and from there again trauma, how did that work for the client, how for a person an experience of a very negative event is very individualized, is very different. Therefore, that's why big T, small T traumas, different kinds of traumas. So now, as of now, the approach that we have, which I would say is a new wave of psychotherapy, is the trauma informed approach, which yeah, I would say currently we are in that field. We've moved a little from, I wouldn't say completely moved from mindfulness, but we're moving a little towards this trauma approach, working on our earlier memories, working on painful memories, trying to process them. Yeah. So I think that's where we are currently.
Yes, that's interesting. What are the therapeutic approaches do you use while practicing therapy?
So yeah, that I would also say is quite a journey. Getting into masters, it was all about CBT, cognitive behavior therapy, and definitely I would say that is the base for most therapies that we have now. So I started off with CBT, which I found very effective. I've seen so many clients do so well after just a couple of CBT sessions. Then I got into MPhil, and also during my master's time, I got very much exposed to mindfulness, and I also felt like I was very much into positive psychology. I really like that approach. I love the whole growth of humans. There is potential. There is their whole actualization, self realization, which I found very, very positive. Hence the term positive psychology. That's where the mindfulness practices came up, and then I was very interested in that. Then I got into MPhil, and I was still very sure that okay, CBT is great, but I really am appreciative of mindfulness, about being the present moment. Because I also think personally it helped me. Trying to be mindful in the present moment was quite hard. So when I was able to apply that as much as I could, I was like, okay, so definitely it is an approach that will help my clients too. Went into mindfulness, and then in my last, I would say, year and a half in MPhil, got very much exposed to trauma approaches, trauma informed therapies, being trauma informed therapist. That was, I would say, during my last year in MPhil, and I would say I'm forever grateful for that exposure that I got in my last 1 year in MPhil. So currently, I would say I'm using a lot more of, there is mindfulness practices that I'm applying, and also trauma informed therapies. So that would include internal family systems therapies there. Then there is EMDR. Even schema therapy is also a kind of a trauma informed therapy as well. But again, it also kind of works along with the CBT perspective also, but it has everything together, has mindfulness also as well. So I would say I am using an approach where I use a third wave psychotherapy, a lot of trauma informed therapy, and very process oriented, because most of the therapies that we have been trained in, let's say CBT, DBT, those are very skill oriented, where you're teaching your client skills. But in these kind of therapies, it's more of process. What the client is bringing in sessions, how can we make them work on those things and process our emotions, process our memories, try to be more accepting towards our concerns, rather than teaching them skills to get rid of that problem. So yeah, I think that's again something that I follow, more of process oriented, what the client brings in sessions, and work through that. Yeah.
All right. Could you elucidate more on IFS internal family system model?
So IFS is all about, so just as the name is suggesting, so it's called internal family systems. The basic idea is, as a person or as humans, we are made up of different parts, or we're made up of different family members, is what they also say. That, let's say, for example, when I'm in a session, my role over there is a therapist. So the part of me that is a therapist is now active there. So I, as a therapist part, have different roles to fulfill. I will have my thoughts about it. I have my emotions based on that. So as a therapist, I need to work in this way. So it's a part of me. It's not that I am that whole person. Rather, I'm that's just part of, let's say, me, Joanna. And now there are different parts. Let's say as a daughter, that's a different role I play. So the daughter part of me, or a friend part. So basically, what they're trying to say is, we are all made of different sub parts, or let's say sub personalities, and we have to, like a family, we have to work on it, work with it together. So the therapist part of me has to also work with the daughter part of me. Maybe there is also a whole other part where I'm just anxious, so there's the whole anxious part of me, but that doesn't make me fully anxious. Rather, just a part of me. But I need to make sure that all of these parts work in sync, and that these parts were all formed at some point in my life to help me. This anxious part also, if we see it in that perspective, that this anxious part of me was formed for to help me out. Maybe at some point in my life, being anxious did help me. So maybe that's why that part got active. So maybe I need to understand as to why that part was formed. Maybe I need to be a bit curious on that part. I need to be a little compassionate to that part because it did help me. So basically, it's about knowing that we are, as a system, we're made of different family members, what they're trying to call it. Just like in a family, there are different members. You try to work with them. You try to talk to these parts individually and see, okay, what's making you be the way you are, or let's say what's the role that you're playing here right now. Can we talk about it? So that's how the approach works. So in a session, I would, let's say, identify a specific part of the client. I'm like, okay, I see that the anxious part of you is very active right now. Do I have permission to talk to this part? Can we maybe talk to them and understand what the part is looking for? Can I be curious about it? So as a therapist, I would help the client get that curiosity on their own, that compassion feeling on their own. So basically, also there's something called as the self energy. So as a human, again, we are made of parts. Now these parts are there formed. Okay. Now there is still some energy in us that we need to use to talk to these parts. So as a therapist, I'll help them identify that self energy. That what is that energy that you have, so that you can use it for your parts. So like I mentioned, being curious, being compassionate, being caring, being creative, um, being connected. These are all self energy that everybody all has. So they even kind of use the term as a soul. So like just like how everyone has a soul, we tend to forget that we have that part in us, or that energy in us. So again, as a therapist in IFS, I would try to tap into that, like get that self energy out, get that those characteristics out, the curiosity, the compassion, and use it to your parts. Like, talk to those parts, ask them what's happening, be compassionate to them. So that's basically how IFS works. It's about knowing that there are different parts in us. They were formed for some reason. They're there to protect us. They're there to make us not feel all the bad memories or the painful memories, and that we might need to talk to these parts, maybe because how it's manifesting now might be different. The intention was to help us, but now it's manifesting very differently and might not be all that appropriate. So that's when they come for therapy, that okay, I'm not okay now because it's showing this way and I'm not doing fine. That's when we go to asking them, okay, let's get curious, let's get that self energy out, let's talk to these parts, let's ask what's going on, why are you here today. So yeah, it's more, I'm trying as much as I can to just touch and go with the approach, but yeah, it's more or less the basic idea.
All right. Since we know IFS is an evidence-based approach, right?
Right.
So,
Yeah.
can you share a success story involving IFS, use of IFS?
So, personally, with some of my clients, just talking in a different perspective has helped them. Like there will be clients that come with eating disorders, maybe binge eating. So that is maybe one of the concerns one of my clients maybe must have had. And for them, they would think that, okay, no, it's really bad. I don't like that behavior. I don't like that part of me. So when I just change the perspective, saying that, okay, it's okay, definitely it is an uncomfortable situation to be in, but let's ask that part as to why you're here. Like, what is the reason behind it? And just having that kind of a discourse with them has really changed the person's perspective. And they're seeing that part as a very, okay, it's just a part of me. It's not completely me. It has been there to help me at a point. So even a client of mine, I started talking to them about this part. They even were able to associate positive memories to this food. For them, food was something that gave them happiness. It made them feel connected to their family because they would go out for dinner, they would go out and have sweets, and they would have a good time with food associated. So then it became a comfort for her or for him. And my client was like, when I got that memory for them, they're like, okay, so that means this part of me actually did help me, is giving me some good memories. So maybe that's why it was there. So just changing the perspective on them, changing and bringing that curiosity out of them, bringing that compassion to that specific part has played a huge role in most of my clients. And I would say that's just the beginning of IFS. Beginning of IFS itself is just bringing that curiosity in. Once that itself, you can see so much difference when we are actually in, let's say, the part work, where we're actually talking to the part and we're trying to get its intention behind it, and it can get quite overwhelming. But just the beginning instance of IFS has made a huge difference for so many clients. Just having that change in perspective, we're talking to that part as a separate person itself is I would say very effective for so many of my clients.
Right. This is way more interesting than I thought it would be. And I'm filled with a lot of questions. Not kidding. So, do psychologists face any challenges while administering IFS? So, if so, what are they?
Mm, right. So with IFS, the challenges that I faced was bringing that curiosity, bringing that self energy, like I mentioned. Many people are not able to understand what this curiosity is. Like, what is compassion? Like, how do I be compassionate to myself? Like, which I find very common among most of us. Being self compassionate is so hard. We can't feel that sense of compassion towards ourselves, a sense of caring, sense of connectedness to ourselves is so difficult. But for some people, it's easier to give it to others. Externally, give that compassion to others is more or less easier than to feel it for themselves. So there has been so many instances where clients didn't know how to feel, or they didn't know what it is to be self compassionate, or self curious, or to be connected, to be creative. They don't understand that concept. Self energy itself was something very difficult for so many people to understand. That I would say was, as a therapist, for me to tap into that and to tell them, okay, this is how it is. So I would have to take the role of that self for the person, for the client, and I would have to tell them, this is how compassion looks like. That's one of the challenges I've faced. Another challenge is to identify the parts. So now, how IFS sessions go is, we are talking, we're having different kinds of conversation, we're just having different discourse. While they're talking, as a therapist, I will have to identify which parts are being active right now. When we're talking, different conversations will happen, different emotions will be shown, different memories might also come, and it might be kind of all over the place. So as a therapist, I have to be quite attentive. I have to have proper active listening skills there. I have to listen to what they're saying, how they're feeling, and I'll have to pause. So that's the thing with also emotions. It's very quick. very fleeting. So you will have to, as a therapist, pause and be like, okay, let's take a pause there, and then we have to make them feel that emotion. We'll have to maybe talk and see, okay, is this a part that is here active right now, which can be quite challenging because again there are different kinds of parts. Some parts are not yet ready to talk. They are very scared because again these parts were there to were formed to help them at some point in their life. So now they're just saving themselves from not feeling, let's say, the negative experiences. So while I'm trying to talk to the part, maybe the part doesn't want to talk. So they get very cut off. They are maybe now in a denial, or they put a wall in front of me. Then how do I go beyond that or go behind that? That could be quite difficult for a therapist to take that step and to also make the client feel safe there. So yeah, I would say that's one of the challenges, doing part work, identifying these parts, trying to talk to those parts, identify their self energy, help them understand what that means to them. Yeah, it can be quite overwhelming even for the therapist to work with that.
Yes. While listening to this, I was a bit curious about the multiple personality disorder. So, how do
Mm.
you use IFS, as an approach towards multiple personality disorder?
Yeah, it does sound a lot like that.
Yeah.
But what is different here is, so now multiple personality disorder is now called dissociative identity disorder. So the basic idea is in DID, the individual is not conscious of the fact that they're dissociating and there is a whole personality that's being formed. It is a maladaptive way of coping. Rather, in part work, it's there, it's not done unconsciously, it's not done in a maladaptive way. Rather, it is done to that must have been active to maybe protect that person, protect a part of them that must have been exiled. So that's also another part, exiled. So let's say something really traumatic happened for that individual. That child, or let's say during that time where the person is, let's say they had the traumatic event at a young age, that person becomes exiled and now they've kept safe. And now there are different soldiers, let's say, that are formed to save that person, to keep them away. They might not know that they're there. So for the person to identify that, that's where IFS comes in. But in the dissociative identity, the individual is not sure about what's going on there. It's very difficult to talk to them because they are not in the present moment. They are not conscious. It's happening very unconsciously in a very maladaptive way. But in part work, you're able to talk to them. There is more active work happening there. Um, then again, we're talking about that self energy there. Also, we're trying to bring that out. But in dissociation, all of that will not work. The person's that energy that I mentioned, that curiosity, all of that will not be there. It's very, I would say, a very maladaptive coping. That's where maybe all of this was formed. But here, the coping must have happened in an adaptive way. But now, how it's manifesting is difficult, or it's different. So that's how it is. So I would say it does sound, when I'm saying subparts and saying subpersonalities, it sounds like a dissociative identity disorder. But the approach is way different. It's, I would say, the approach is very experiential. In therapy, only will you experience this, and then only it will make sense for the client. So yeah, I hope that I'm able to make that difference there.
You really have a keen way of explaining things. I mean, really.
Thank you. I appreciate that.
Okay, so who is most likely to be administered with IFS? Do you recommend young psychologists to administer IFS?
I would suggest doing IFS a little later in your career, in the sense, I personally have felt that because I had that journey of starting with, let's say, CBT, then I went into mindfulness, then I went into trauma approach. I felt like I got a very good base in therapeutic approaches Because what happens is when you jump into a specific kind of an approach in therapy, you will only be looking in that perspective. So when a client comes and you're trying to use, let's say, the approach that you only know, it might not always work. Hence why specific therapies have indications and contraindications. um, and also in terms of the goals that the client comes with will be very different than what you have in mind because of your therapeutic approach. So I personally have felt the gotten that advantage of being exposed to, let's say, the initial different schools of psychology and different, let's say, therapeutic approaches, different waves of therapy, and that gave me a good base to try for, let's say, trauma informed approaches. But definitely, I would suggest getting open to it, or let's say reading up on it, um, getting an idea as to what it is. And definitely, if IFS is your calling, you will know it. I wouldn't suggest anyone jumping into it directly because, like I said, then you will only get that view and it'll be very difficult to work with different clients. Not only clients, when you are, let's say, with your colleagues, when you're working, like you're working in a fraternity here. So when you're in that fraternity, you kind of also have to be open to different approaches, be aware of how the approaches work and be open to that, because also when you're stuck in your specific approach can be very difficult to see clients in a different perspective. So definitely be open to different approaches, read up on it. If possible, there are, I would suggest there are different workshops also that are there, which is still very up and coming, IFS also. So try to expose yourself to, let's say, different approaches that we attend, different workshops, read up on it. If it's your calling, I would definitely suggest you getting trained in it. So IFS has like a specific training course, level 1, level 2 training is there. Even before you get into that training, I'd suggest just read up on that, get an idea about it, and if that's something that's really what you're interested in, then definitely get into IFS. Again, I wouldn't suggest anyone just jumping into it directly. So yeah.
Definitely, exposure is really very important, especially in the field of psychology. Yes.
Yes.
So, to make it easier for our aspiring psychologists out there, could you please provide a mental roadmap towards IFS as a therapeutic approach?
So, like I mentioned with IFS, it's I would definitely suggest by just reading up on the therapy, what the approach is, getting, let's say, the development of it. Again, there are different workshops, but again, when I'm suggesting workshops, I wouldn't suggest the workshops that are not, I would say, done by a qualified person, someone who is IFS trained, who's providing with the workshop, definitely. um, then once you're a little aware on it, I would then suggest you going, there's a IFS institute, that is there, there's a website also, they have IFS institute website is there. Get into that, that's where they provide with the level 1, level 2 training. So even I would suggest, even after, let's say, your masters, after you've done your masters in psychology, masters in clinical psychology, there are a lot of people who are trained in specific to IFS after that, that is level 1, level 2. Again, until unless you're sure that that's your way of approach with therapy, then I would really suggest you going forward with that. But again, with getting into the training can be quite difficult because there's a long waiting period. So what I've heard is, again, there are different ways of also getting through that. There is a lottery system also that they do, which is again something that they're trying to get in as much as people to get trained. So I would say getting trained can be a little difficult initially, but I would still say it's getting better now. So that's something that is there. And even there are these there's this website called PSY UK is there. That's where they provide these kind of free webinars, free seminars on different approaches in therapy, which I will say it was a huge eye opener for me. So they talk about different approach, different therapies there. And that is something that I would also suggest for people to do. It's not, I wouldn't say that you'll be trained in that, but rather it'll be like an just a overview of the therapies that they are providing. So that is something that they can try. And yeah, definitely following IFS trained professionals, going into that IFS Institute websites, reading up on that, I would say that would be a first step in getting into IFS.
All right, that was such a fresh perspective indeed. So, talking about IFS, I recently read about group interpersonal therapy. So, could you please elucidate on how it works, or is it just a mixture of a few therapeutic approaches?
So, group interpersonal therapy is, I would say, completely a different approach in therapy. So it's like the name suggests, it's on group.
Hmm.
So basically, what the idea is that um, it's about mostly learning certain interpersonal skills. It's more in the view of interpersonal relationships. So I think it's basically the idea that was initially formed that individuals who were diagnosed with depression, they were a lot more of uh, their social skills, or let's say their attachment towards the social world had reduced a lot. So that's when the idea came that maybe there is some interpersonal aspect to that. There is something there that maybe we need to look into, because the models of depression at the time was very individual. It was about the cognitions, it was about the behavior. That's where interpersonal therapy or interpersonal model came into play, where there is the person's interpersonal skills, or those concepts is very much affected as well because of the depressive symptoms that they're experiencing. So that's the basic of how IPT started. So there will be issues, the problems maybe in their role at the time. Let's say for example, a woman becoming a wife. So the role has changed. Let's say from a daughter to being a wife is changing. From being unemployed to employed, again, the role is changed. So, like an example, so there is a problem in their role. Then there is interpersonal dispute, let's say between two people or between a couple. So then that's maybe could be a reason for them to have, let's say, depressive symptoms. They're lacking interpersonal skills, hence maybe the depressive symptoms. Even grief is also a specific problem area in IPT that they focus. So losing a loved one is also another, let's say, an etiology also maybe for depressive symptoms. So that was the basic idea of IPT. Now, when group came into it, is because just like the name suggests, interpersonal. That is means to have interactions with people. It's to be socially connected to other people. So I think the idea of group came into that, is to use like these problem areas as suggested and use it in a group setting. So it's giving them a more of a in feeling that, I'm not the only one who's having problems, let's say interpersonal problems. Rather, there is a lot of other people, and having that sense of group feeling really helps. And also at the same time, there could be a lot more discourse in that. There's a lot more conversations on that. There's a lot more open discussions on that, which as a person maybe who's, let's say, lacking interpersonal skills can learn it from, let's say, in being in that group setting itself. So I think that's the basic idea of group IPT. But again, personally, I haven't done that therapy, and I've only seen that work. I've seen it I've observed how it works, and I would say um, it can be quite challenging, because like I mentioned, this therapy is for individuals who's having depressive symptoms usually. So that's where the model comes up of. So especially when an individual is having those symptoms, in terms of interacting, in terms of being in a group, can be quite overwhelming for a lot of the clients, again depending on their problem areas. But that could be quite challenging. But I think since the basic idea is about IPT, having a group setting is also a very effective method, I would also say.
Definitely, it might be comforting for somebody, but it may not
Yeah,
be for somebody else. Yes.
yeah.
Now we discussed a lot about these therapeutic approaches. Can you please shed some light on how these therapeutic approaches has evolved in modern times?
So like I mentioned also, that the perspective of a client, or let's say from a therapist perspective, a therapist point of view, how you view your client, I would say, has very much changed. Like I mentioned, initial therapies were all skill oriented therapies, about saying that, okay, this client lacks this skill, that skill, we need to teach them this, we need to tell them this is how it is. I would say currently that has shifted a little by saying that, okay, it's not that maybe you're lacking a skill, rather maybe you have that skill and then we might need to just help you get to that. We as a therapist just being a catalyst there. um, and also definitely focusing on, I would say current approaches are mainly focusing on family dynamics, on attachment styles, which I think was also very much lacking even when it came to alcohol dependence. I would say it was always about, okay, alcohol is a problem, we need to fix that, we need to help the person get rid of that issue. But now the approach is very different, that okay, person does have an alcohol issue, but that is actually not the problem, rather it's a solution for some problem that the person is trying to get rid of.
True.
What is that root cause? Like, let's go back to that. I will still say it's in a very infancy stage about the approach in alcoholism. um, People are still very condescending towards that problem. That, I would say, again, that is a different approach to the disorder. Which again is a very trauma informed approach, that okay, there must have been that for the individual to have this dependence on this specific way of coping, something must have happened for that client. Let's go back in time and try to get that. So alcoholism is a way of coping. Let's help the person learn other ways of coping. Let's not just say alcohol is a problem and get rid of it. No, let's change the perspective on that and try to help the client feel compassionate to themselves, that okay, this is the only thing that I knew to cope with. I think that is an approach that most of us need to have, even if we are not therapists. I feel like even being another human, like, seeing that perspective is really shifts, because there'll
Definitely.
be a lot of caregiver burden. So when the family member is going through this, the first thing that I want to get rid of the problem, get rid of the problem. Not even with that, not only with alcoholism, any kind of disorder, get rid of it. Like, stop being sad. Like, just be okay. Like, get rid of that problem. Like, no, like, ask them, be curious. What's going on? Where is the root cause? Let's talk about that. And I think that is a major shift that therapies, I will say, now are up and coming, about being that curious, being very compassionate, going back in time and getting the root cause there. Is it a way of coping? Okay, let's work on coping then. So yeah, I would say that is something that is very much in change now. Yeah.
Yeah. I feel like, yeah, the past was very, very focused on solution. What is the solution for this?
Yeah,
That,
exactly.
and
Yeah.
with that. But now
Mm,
we are
exactly.
focusing a lot more on healing. So,
Exactly. That's the word. Yeah, I would say that's a perfect word you use. Healing. Yeah.
what is your perspective regarding the idea of self therapy, where some people believe they can heal themselves using these digitally available resources? And can you also
Mm.
shed some light on these terminologies blindly used by people nowadays?
Yeah, that I would say is the next epidemic for our for our generation. I feel sometimes that there is so much of information online. There's so many things online, and also people tend to only get the information that relates to them or is in their belief system. So then they get misinformed. So that is quite a challenge. I'd always, even with clients that come to me saying that I have this problem, I have that problem, I'm like, okay, again, as a therapist, I have to be curious there and I have to be compassionate to them as well and be like, okay, where is this coming from? Like, where are you learning all of this? And let's talk about that first rather than the problem that they came with. Um, and I would always suggest my clients is, if you're in therapy, I would suggest you not reading up and without me, let's say, suggesting reading materials. Definitely that is part of therapy. I will suggest reading materials to them. Until unless I would suggest, try not to read, because you will tend to get into a rabbit hole and you will lose yourself in that completely. It'll cause you more anxiety, it'll cause you more problems. I wouldn't even say that this applies to psychology or let's say in therapy, but rather even physical health. People who have gone through a lot of problems physically, the first thing they do is they start Google it. So go to Google Doctor, ask the doctor, okay, Google, what is my, this is the issues and what do I have? Okay, it'll end up being brain tumor. So it'll lead to that. So even I would say in the medical field itself, it's a huge issue that I would feel like professionals have to talk about it very much out front. Say, don't read up, come to me for problems. If you have a thing, if you have an issue, you have a doubt, come to me, let's discuss. Which also sometimes can be quite difficult for some professionals to even do that discussion. It might look very confrontational, and it might the client might feel, okay, maybe the therapist or let's say the professional is not good in what they're saying, so they don't want me to read, they don't want to read to know the truth. No, it's never the idea. It's just so that you will know where to read, what to read, because it'll cause you more anxiety, more ruminations, and you start overthinking. Because even for me personally, like when I go through some physical problem, I tend to go to Google. Then I realize, okay, no, it's not helping me. I'm getting more anxious. Okay, I need to stop. So telling yourself that, okay, if I have any concerns, I can always talk to a professional, someone who's trained in it, and talk about it to them. Yeah, it's always better to go with, again, open mind, go with a clean slate to your professional, or to your doctor, or even to your therapist. Go with the clean slate, because it's always helpful. If you go with so much of information, you tend to only listen to that, and you tend to only want to hear that, which will be very difficult to manage.
Yes. I feel like one
Yeah.
of the common reason why we do it, maybe we are trying to save time. Okay, fine, I'll just save some time. Their health is not important, money is important now. I feel like that is the bitter truth of today's society. Okay, fine. I know what the professional is gonna say. I know it. The Google
No.
knows it. So, yeah, so we try to figure
Yeah.
it by ourselves, but that is the black hole. And
Yes, like
yeah,
don't worry about the time. Like it's fine. Like just come open minded. We are there to help you. It's our job. It's okay. We're here.
indeed.
Yeah, it's true.
I feel like that is indeed a crucial message that everybody should be aware about. Now,
Yeah.
I am filled with questions, but our audience are too. So, without much delay, I'll ask them right away. So, can you highlight on the needs and importance of psychologists in today's world?
Very, very much important. Very much needed. Demand is so high. Um, Definitely, it's a field that is still growing. When I got into the field itself, it was just starting. It was, I would say, like I mentioned, like the infancy, fetal stage. Now I would say it's still growing, but it's really, really important now. And I also feel after COVID hit, things perspective on mental health has changed also quite a bit. Things are so easily accessible now, especially the fact that therapy can be done online was such a alien concept back then. Now it's very common. Everybody can easily get help online, obviously with being careful of how you get that help also. um, but because there's so many people that are talking about it, the awareness has very much increased. um, Also to be taken with caution, but psychology as a field, I don't think it would ever stop growing. Psychologists are very much needed these days,
I agree.
because I would say the stress that our generation and the future generation are experiencing are very different from how our early generations were experiencing.
True.
Now everything is on the tip of your fingers. Everything is technology. Everything is now binary. So you tend to get very overwhelmed with the information that is coming. It can cause so much stress for anyone and everyone. Um, and definitely that's where psychologists come there and help you out. That You need that helping hand. You need someone to be there for you and tell you that it is overwhelming, it is stressing, and that you can get that help, which I don't think early generations had that as much. It was quite difficult to get help, to talk about it. And again, because the level of stress was very different back then. Here it is, they might not understand that, but now it is very much needed. um, and needed in a very professional way, I'll suggest, very trained way. It's not something that also everyone and anyone can do. Being a psychologist, it can be again quite overwhelming, can be difficult. It is a very um, it's a job that can cause very high burnout very quick, but it's very important in our day, in this current scenario. So yeah, I would say psychology as a field is still ever growing, and I'm very glad to see that people are also taking that step to work on that. So yeah.
Yes. Not only did you answer my question, but your answer really, inspired me to keep going. So recently, there was a lot of chaos in the minds of PG applicants, while making a right decision, choosing an educational institution to study from.
Hmm,
So could you
hmm.
shed some light on colleges or universities which offer clinical psychology?
So actually, again, personally, I have noticed in the last couple of years the psychology course is very much um, it's again still up and coming in different universities. I would say there's still new colleges that are providing that course. um, I would personally honestly say I don't have first hand information on the new universities that are there, but one thing that I'll always suggest everyone who's looking into this is that whichever college that you're looking at, always check the syllabus that they're having, that they're providing, where which university it is affiliated to. And something I'd always suggest personally also, I felt, so I had done my masters in a hospital setup. That really helped me get exposure with patients, with doing assessments, and that really made a big difference. So what I can personally tell is, when you're looking into a university, always look at what the subjects they're providing, what is the exposure that they're giving, what university they're affiliated to, again, how many years they have had that course there. Is it a still new course? How are they going to manage with the new course that's coming? The universities approach towards the field, because again, uh, the number of universities and colleges that are starting with psychology is a lot. Like, I was also just going through it recently, and then every time I'm hearing new universities and colleges that I honestly haven't heard of. Still, they're very up. So many are coming. So sometimes I get also a bit worried as to, okay, there's so many universities now, which is a good one? Like, if I was in that state, how will I know which one to go for? It is easy if it is a university that has been there for years, like let's say Manipal, or if it is um, Christ, or even if it's for MPhil, then Nimhan. So all of these years we've heard, everyone knows about it at some to some extent. But the new and up and coming ones, how are we going to trust them completely? And to get in through other universities can be quite hard. So
Yeah.
I always suggest, I have personally realized that if you do your good research on the university that you have seen, see the syllabus, see how the field is, see how the environment is, how long has it started, what's the exposure there. That I will say personally is something that will help. So yeah.
Yeah, definitely there are a lot of factors we should consider before choosing one,
Mm,
because that would be a stepping stone or a foundation for our career. So I feel like
yeah,
that's
yeah,
really important and a crucial choice indeed. Yes.
definitely.
Yeah. So I've heard a lot of different perspectives on this following question, and I would love to have your perspective on this. So, do you recommend studying clinical psychology in India or abroad?
Okay, it would really depend on where you see yourself. It'll also very much depend on definitely finance. That is also a big thing you have to keep in mind. Um, Also, one thing of studying here in India, being a clinical psychologist here, like I mentioned, in India, clinical psychology or psychology is still growing, very much growing. The acceptance of it is also still growing. People talking about it is also still happening. Abroad, I would say it is more or less developed. It's more or less very much understood. There is a lot of regulation bodies over there. So many associations are very much keeping it in check. I would say it's more or less structured
Yes.
in structured abroad. Here is still they're still working. They're still trying to figure out how to regulate it, how to work on it. Even as a professional, what are your benefits? All of those I would say still up and coming here. I would say if someone who is ready to be part of that journey, be part of that initial phase of clinical psychology in India, working in the front line of that, then definitely India is a place because it's you can make your own opportunities here in India. If you want to start up something on your own, you have every liberty to do that here because maybe not a lot of people have done that. Back in abroad or back there, everything is kind of fixed, everything everybody knows, stuff is already developed. So you're just going there as an addition over there. Again, if it really depends on your quality of life, you want to have a whole other different lifestyle, you want to have exposure to different things, then you can definitely choose based on that. Career wise, I'll always say I've always found that India in terms of clinical psychology is or psychology is still they're still growing, they're still learning. And if you're ready to be part of that journey, then definitely you will do great work here. People will recognize you and you'll be very much accepted, and that is very much also needed here, I feel, in India. People still need to be there ready to take that step and work and talk about it as much. Again, over there it's easier, things are very easy there. Also, yeah, be
Yeah.
abroad, being affiliated to a university that is already knows psychology and very much strong in that field, then it's easy. It's a great thing also. But here, I would say that's the current scenario here in India. So I would say based on that, where you want to fight your battles. Do you want to be in the front line and be part of it, or you want to be fighting? Okay, but you're there, like you're already fighting for something that's there. So yeah.
Yeah. Yeah. So we are still in the process of structuring everything perfectly.
Mm,
So I feel like that will be done very soon. I
yes.
hope so too. And thank you so much for sharing your perspective on this. And we are almost at the
Thank
end of
you.
our podcast. And I'm
Okay.
personally, this is the last question, and I'm curious about what is that one message that you would like to give to our aspiring clinical psychologists out there?
I would say take your time. Don't rush into this field if you think it's not for you. Like I said, it can be quite overwhelming. Personally, it can be overwhelming. Professionally, it can be overwhelming. Don't rush into things. Don't have that feeling that I need to know everything, I need to learn everything. No, take it as it comes. Have an open mind. I think that is something that I have personally learned. Have an open mind, go with a clean slate, and always be ready to learn every step of the way. Even if you've been in the field for years and years, don't forget that psychology is a very evolving course, very evolving subject. You will be learning new things every step of the way. Be open to that and try not to be rigid in your, let's say, your field or your approach in therapy or your approach in psychology in specific also. Be open to that because that is something I have personally learned. And I've seen also a lot of people when they're struggling, when they're stuck in their specific approach, it's very difficult to go forward. And you yourself, as professionally, you will be stuck. you will not be able to move forward. So I would say that's the takeaway message. Just be open, take every step, um, having that mindset, and yeah, having a clean slate every step of the way will always help.
Yes, that is indeed really important. And thank you so much for sharing your insights and experiences with us. It's been a pleasure having you on this podcast. And thank you for
Thank
paving
you.
the right way for our ambitious students listening to us.
Yes, thank you. Thank you so much for giving me this opportunity to give my opinions. Yes, it was really wonderful.
Yes. And that concludes another thought provoking episode of Esprit Talks from CS Spray. Thank you for joining us and be sure to tune in next time as we continue our exploration in psychology and mental wellness. Until then, live, love, and learn psychology with CS Spray.
Today, we'll be talking about therapy and mental health. And for our episode, we have Sachi Arora, a distinguished clinical psychologist who positively impacted many lives.
Do with humanities? Kuch nahi karegi. She'll be the only one in the class. There'll hardly be 5, 10 students. What will she do with this? I don't think she's going to make a good career out of this. This is the field if you're interested to help people, be empathetic to people, guide people, and help them navigate through their mental health journeys. The world out there does not allow you to really have that space where you can just be and cry or be vulnerable or express your emotions. It's easy to say, put yourself in the other person's shoes, and that's what empathy is. But it's another thing to actually understand things from their perspective.
How can therapy help someone who's been through grief and loss?
In therapy, there is a proper practice that I do, that I ask them to bring photographs of their loved one, and I ask them to talk about some important memories with the loved one that are there in the photograph.